Diagnosing and treating diseases in chameleons presents a complex and demanding challenge due to the unique physiology, subtle behavioral cues, and environmental sensitivities of these reptiles. Unlike more commonly kept pets, chameleons are solitary, highly sensitive animals that often do not display obvious signs of illness until the disease has progressed significantly. This makes early detection a considerable obstacle for even experienced reptile keepers. Their tendency to mask symptoms, a defense mechanism rooted in their wild instincts to avoid appearing vulnerable to predators, further complicates diagnosis and can delay necessary treatment. Chameleons can suffer from a wide variety of illnesses, many of which are directly linked to suboptimal husbandry conditions. These include metabolic bone disease, respiratory infections, parasitic infestations, organ failure, eye infections, and stress-related disorders. Each of these ailments may present with very subtle or overlapping symptoms, making it difficult to isolate the root cause without a thorough veterinary examination that includes diagnostics like blood tests, fecal exams, radiographs, or even biopsies. Metabolic bone disease, one of the most prevalent conditions in captive chameleons, stems from calcium deficiency, lack of vitamin D3, or insufficient UVB exposure. The slow progression of this disease often results in misshapen limbs, tremors, jaw deformities, and general lethargy. By the time these symptoms become visible, the damage to the skeletal system is often significant and, in many cases, irreversible. Treatment typically involves calcium supplementation, proper UVB lighting, and dietary corrections, but long-term care is often required to manage the consequences. Respiratory infections are another common issue in chameleons, particularly when humidity, ventilation, or temperature parameters are not properly maintained. These infections are frequently caused by bacteria or fungi that flourish in overly moist or unclean environments. Symptoms such as wheezing, gaping, excess mucus, or reduced appetite can signal respiratory distress. Diagnosing such infections requires veterinary assessment and may necessitate cultures or imaging to determine the extent of lung involvement. Antibiotic or antifungal treatments must be carefully dosed, as chameleons are highly sensitive to many medications. Parasitic infestations, both internal and external, can have a detrimental effect on chameleon health. Internal parasites such as nematodes, coccidia, or protozoa can cause digestive distress, weight loss, and lethargy. External parasites like mites can cause skin irritation, stress, and secondary infections. Fecal testing is the primary method for detecting internal parasites, but accurate identification often requires multiple tests and specialist knowledge. Treatment usually involves antiparasitic medications, which must be used cautiously to avoid further compromising the chameleon's delicate physiology. Another significant concern in chameleon health is organ failure, especially involving the kidneys and liver. Chronic dehydration, a common issue in captive environments, can lead to kidney damage, resulting in gout or other metabolic issues. Since chameleons often drink only moving water or droplets on leaves, providing adequate hydration through misting and drippers is critical. Kidney and liver issues may manifest as lethargy, swelling in joints or limbs, and changes in coloration or urate consistency. Blood testing and urinalysis are essential tools for diagnosing these problems, although many reptile veterinarians may lack the specific tools or expertise needed for chameleons. Eye infections and related problems are especially prevalent due to improper humidity levels, foreign objects, vitamin A deficiency, or bacterial contamination. A chameleon suffering from an eye issue may keep one or both eyes closed, rub against branches, or exhibit impaired targeting when hunting prey. Treating these problems requires identifying the cause, which could be anything from environmental irritation to systemic infection. Topical treatments, dietary supplementation, or systemic antibiotics may be used, but treatment compliance is difficult since topical application is challenging on such small and delicate eyes. Stress-related disorders in chameleons are also a leading cause of illness and death. These reptiles are extremely sensitive to environmental changes, frequent handling, excessive noise, the presence of other pets, and even reflective surfaces. Chronic stress suppresses the immune system, making chameleons more susceptible to infections and slowing recovery from existing illnesses. Stress may present as persistent dark coloration, refusal to eat, excessive hiding, or aggressive behavior. Managing stress requires environmental corrections, minimal handling, and ensuring the chameleon has ample visual barriers and appropriate hiding places in its enclosure. One of the core challenges in treating chameleon illnesses is the lack of specialized veterinary care. Reptile medicine is still a developing field, and many general practice veterinarians are unfamiliar with the specific needs of chameleons. This can lead to misdiagnoses, improper treatment protocols, or hesitancy to prescribe necessary medications. Furthermore, the fragile nature of chameleons makes them particularly vulnerable to stress during transport and examination, compounding the difficulty of providing effective veterinary care. Finding an experienced herpetological vet is often the first and most critical step when a chameleon shows signs of illness. Even with an accurate diagnosis, treatment of chameleon diseases often involves a multifaceted approach, including environmental correction, dietary supplementation, hydration therapy, and in some cases, force feeding or fluid injections. Administering medications can be difficult due to the chameleon's reclusive behavior and reluctance to open its mouth. This sometimes necessitates the use of feeding tubes or injections, procedures that carry their own risks and must be handled by professionals. The time-sensitive nature of many chameleon diseases means that delays in diagnosis or treatment can quickly lead to death, underscoring the importance of daily observation and preventative care. Preventative care remains the most effective method for reducing the risk of disease. This includes providing a well-maintained enclosure with appropriate lighting, humidity, temperature gradients, hydration sources, and a varied diet rich in essential nutrients. Regular fecal exams, periodic veterinary checkups, and ongoing observation for subtle changes in behavior or appearance are essential for early detection. Maintaining low-stress environments, limiting visual and physical contact with other chameleons or animals, and avoiding overhandling are all key elements of chameleon husbandry that contribute to long-term health. Hydration plays a particularly critical role in disease prevention. Chameleons, unlike many reptiles, do not typically drink from standing water. Instead, they rely on dripping or misted water that mimics rain or dew. Owners must establish reliable hydration systems, such as automated misting systems, drippers, or regular manual misting, and monitor urate color as an indicator of hydration status. Dehydration is a gateway to many health issues, including organ damage, skin shedding problems, and compromised immune function. Dietary deficiencies are another common contributor to illness in captive chameleons. Feeding a limited or unbalanced diet, or failing to supplement with calcium and vitamins, can result in metabolic bone disease, immune dysfunction, or vision issues. Feeder insects should be gut-loaded with nutritious foods and dusted with calcium and multivitamin powders according to species-specific guidelines. It's important to provide a wide variety of feeder insects to avoid nutritional gaps and encourage natural hunting behaviors that also contribute to mental stimulation. In multi-chameleon households or breeding setups, disease transmission becomes a heightened concern. Chameleons housed in close proximity may become stressed or transmit pathogens through shared air, surfaces, or handling tools. Quarantine protocols should be strictly followed for new or sick individuals, and enclosures must be sanitized thoroughly and regularly. Tools should not be shared between enclosures unless properly disinfected, and any signs of illness should prompt immediate isolation and veterinary consultation. Infections in chameleons can progress rapidly, and due to their slow metabolic rates, recovery is often prolonged. Patience, consistency, and vigilance are necessary qualities for any keeper treating a sick chameleon. Even with the best care, some illnesses may be terminal or leave lasting effects, so quality of life considerations must be taken into account when determining long-term treatment plans. Euthanasia, while difficult, may be the most humane option in cases where suffering cannot be alleviated. In summary, the challenge of diagnosing and treating chameleon diseases is rooted in their complex husbandry needs, subtle clinical signs, and limited access to specialized veterinary care. Success in this area demands not only a deep understanding of chameleon biology and behavior but also a proactive commitment to environmental management, dietary excellence, and early intervention. Chameleon care is not for the faint of heart, and those who choose to keep these extraordinary reptiles must be prepared to meet the demands of such delicate and intricate creatures.